Hey y'all, this is Jessica, your host for the Core 4 Momentum podcast. I am so happy to be with you guys today. Today, our episode is going to be all about fertility and how physical therapy can help. I am so honored to interview Dr. Yeni Abraham, and I'm just going to let her, she's a physical therapist based out of Texas, and I'm just going to let her introduce herself, and then we'll get into today's episode.
Thank you so much for having me, Jessica. So like she said, my name is Dr. Abraham. I am the proud owner and physical therapist at Triggered Physical Therapy. We're located in Arlington, Texas, in the Dallas-Fort Worth area. We've got a great group of physical therapists. We're just growing the practice, and we pretty much specialize in women's pelvic physical therapy. So everything from chronic pelvic pain to pelvic floor dysfunction, postpartum issues, prenatal issues, all the way to mechanical infertility for women. And so we're true, like I would say, we're a true women's health practice. Kind of get to see a bit of everything. It's a lot of fun, and I'm honored to be here. I love women's health. I'm super passionate about it. Excited for our discussion today.
Yay! Before we get into the discussion today, because I'm curious,
Mhm.
how does your passion for women's health start?
Oh man, this is a loaded question. So I'm gonna tell you right now. My dad's a preacher. I grew up in the church, so I'm trying my best not to be long-winded. So
I love it.
I would try my best, but I'll say so. I have, I have had my personal challenges with healthcare for years. I've had some endocrine issues. I've had my own reproductive issues, and so I think naturally, just because of my personal walk, I think it's just lended my ear to the empathy that goes with being a woman and having to overcome feminine issues, right? Because it's no walk in the park. I mean, someday I'm gonna find Eve and bust her in the corner like, sis, why'd you start this? Okay.
What's
Like you
up? Like, why us?
on it, you could do anything else, okay? But to be sincere, I think I've just always had an affinity towards it. And growing up, I have moms, and my mom and my aunts and cousins that have had overcome quite a few specific um women's health problems. And so I've been around struggles with women's health. And I would say that it really started for me when I was struggling with thyroid problems in college, and I decided to take ownership of my healthcare and change the way that I ate, change the way that I moved, change the way that I spoke to my body. And I realized that my body responded, and I was able to reverse a lot of the things that I had given permission to science to do. And it was just a sweet spot for me because I all of a sudden found that even though I was pursuing physical therapy and studying in the medical route, there were some holistic principles that I was able to adopt. And so I was like, there seems to be this great marriage between holistic science or holistic medicine and Western medicine that speaks to the basic needs of how women's bodies can optimally perform. And so for me, it just always made sense to pursue that. And so I've kind of self-taught when I was in PT school. And even when I left PT school, I started kind of just getting into the field of women's health. And even when I took making acute care, I never stopped learning. I never stopped engaging with women's health physical therapy content. And it just was just a perfect, I did give myself a deadline. I remember telling myself, after X amount of years, I need to figure out if I'm going to really own this or if I'm just going to be a standby. And I'm one of those people, I like to be out in the field. I'm not a spectator.
Yeah.
So it was just such an honor to be able to jump headfirst and be able to start serving people with this physical therapy skill.
Yay.
Yeah.
That's awesome. I feel like a lot of women who are physical therapists and they go into women's health, pelvic health, they have personal stories similar to yours,
Yeah.
or they just have empathy for someone who they love who has a story that way. So thank you for being open enough to share yours with us.
No problem.
Okay, so let's start with defining infertility. How would you define it?
All right. So I'll give you kind of like our medical definition of infertility. So typically infertility under a woman that's 35, a couple that's 35, is when you have been trying with a normal cycle for up to 1 year and have not been able to conceive. So that's when a healthy couple under the age of 35 has been trying for up to 1 year and have not been able to conceive on their own. Now, if you're over 35, that drops down to about 6 months. Excuse me. And so that's kind of just the infertility. So a couple becomes infertile when they've not been able to try during that length of time. Now, I will say that in more practice terms, infertility is much more complex, right? Infertility is everything from not having normal cycles, irregular cycles. It doesn't matter if you've not had irregular cycles for 3 months or your whole life, right? Infertility is when you are not able to produce a certain amount of eggs, your ovarian reserve is low. If there's a male factor, we call male factor infertility, if there's issues with sperm quality. And so a lot of people are dealing with infertility issues, but don't necessarily get the definition of infertility until they start trying. And that's when we really get to put a name on it.
Okay. I mean, that would make sense, because how would you know until
You don't know until you start trying. Exactly.
And I like how, so the definition is a couple trying.
Yes.
Let's, and I know you just from following you, and I know you debunk myths and misconceptions all the time. Yeah. So whenever we hear infertility, at least for me and what I feel like the public, when I hear it, automatically they think about the woman, and like the woman being infertile and the woman not being able to, have a child. So can we debunk this? Like, what do you?
Let's do that. Let's debunk it. It is not a one-sided track. No, ma'am. No, Jessica. It takes two to tango. And if we're talking just a traditional heterosexual couple, I find a lot of women who have partners, male partners, who don't even participate in their fertility journey, right? Who aren't getting the testing. And one of the first things that I do whenever I'm doing my evaluations is I'm always asking, what is the role of your partner? Has your partner been checked? Have they done a sperm analysis? Are they taking care of themselves holistically? Are they a smoker? Are they a drinker? And it's usually typically it's like, oh, I haven't really talked to him about it. I'm just thinking it's because us as women, we naturally take the ownership of fertility when we realize like, no, you're gonna need the sperm anyway to be able to produce, right? So it's definitely a two-sided coin, and there is no way to have a appropriate and a complete conversation about fertility if we're not talking about both sides.
Yeah,
absolutely.
I totally agree. And I found a stat. You can tell me if it's old or if it's something that you've heard, but it said that about like 40% of it is men, 40% is women, and then 20% is like either a mix or both or idiopathic.
Or genetic. Absolutely. I think that's a pretty accurate kind of percentage or statistic you have there. I've heard similar kind of stats. I've heard of like a third of every infertility couple or couple struggling with fertility, it's actually due to male factor infertility. And I'm going to be sensitive in saying this because, I mean, if you're listening to this podcast and you are maybe on the receiving end, right? And you are in a relationship with a male who is struggling with infertility and is not able to come to terms with it. Let's not sit here and say that society has given men a chance to figure that out either. Let's be honest, right? I think us as women, because it's more commonly discussed, women are more likely to pursue the help and know where to go, right? The average man who struggles with infertility, one, may not know, or two, maybe when he does know, doesn't know what to do about it.
Yeah.
Right. And so I always kind of like lend the empathetic air because I don't want us to put baby in the corner and make him seem as if he's just a mean person for not doing anything about it. Most men don't know what to do. They don't even know that their diet and their habits have anything to do with their fertility or their sperm quality, right? Mm-hmm. And so it does take the support and the understanding and the maturity aspect of a man to really be able to accept what that means. And so on a more medical side, I've got a great urologist in the Dallas area who specializes in male infertility that I always say, hey, if we know that that's a male factor issue, let's get him to see her. Let's not just put this on you. And let's not make this an unfair process for you and treat you and you not get pregnant anyway, because we needed to also treat him.
Yeah. And I mean, that's great. That is really great. Ultimately, because like you said, it takes two to tango. If someone has been trying, who is listening, who has been trying for over a year, yes, the woman should go and seek treatment for fertility and see what's going on, but the man as well. And
Absolutely.
hopefully the male can find a provider who can help, because I think grossly, like, women are, it's readily available for women. And like you said, men don't know where to go. But we want
Yeah.
to support the whole family unit.
Absolutely. You got it. And just know that have those conversations early on. This is kind of just, I'm not trying to veer off too much, but I just always have a heart to just have that conversation. Like have the conversation early on in the relationship. Don't make this big old thing. And sometimes we say ignorance is bliss, but I think ignorance is not bliss. I think ignorance has its cost, it's consequential. What you don't know can hurt you.
Mhm.
And you don't know what you don't know, and what you don't know, you don't know what to fight, right? And so women, hello, we need to really make sure that we're honoring our bodies and
Mhm.
not putting ourselves under unnecessary medical attention if that's not the issue.
Yeah.
So I think you've got to fight it on both sides. You've got to be clear about what's going on. And because I'll have women that'll come and they've had failed IVF, cycles, and then they're like, okay, well, I just need, Mercier, or I just need what you're doing as a physical therapist, and then I'll fix my problems. And I'm like, okay, well, is there a male factor? And they go, yes. And I'm like, ethically, I'm not going to treat you,
Mhm.
because I'm not going to let you put your body through that if the issue is him.
Mhm.
Yeah.
Wow. So let's talk about the different kinds of infertility, because I know you spoke earlier about mechanical infertility, and I don't
Yeah.
think enough people know that it's not just this one way that you can be infertile. There are different causes and different types. So can you highlight those for us?
Absolutely, Jessica. So I'll kind of briefly kind of go over some major types of infertility, okay? So and I'll speak more broadly about the kind of infertility that I work with. So we have genetic infertility, right? That's where if you are born maybe with one fallopian tube, or you do not have a genetic, like anatomically your uterus is smaller or shaped a certain way. There's some people that are born with two uteruses. I know that's a genetic disposition as well. And you may think that makes them super fertile, but unfortunately it doesn't. And so there's sometimes genetic things that affect people's fertility. And typically people know that pretty early on. They can probably figure that in their, adolescent years when they start having their cycle and they're realizing things are not as normal. But unfortunately, some of the more specific medical issues do not come up or are not presented until they're trying to conceive, right? So it's really important that if there's a genetic abnormality, if there's maybe poor communicating fallopian tubes, there's more generic genetic terms that they have there, and they can kind of diagnose you specifically. Now, there are types of infertility that people have that may have to do with what they call idiopathic, where if you've developed infertility over time, maybe because of the choices that you made, lifestyle choices, maybe I'm trying to think of a really good example. Some people, maybe because of the type of medication they took, they had a really botched, it's skipping my mind right now, but I'm going to remember it. There is a documentary on Netflix that came out a couple of years ago regarding a type of um, birth control implant that people can put in their tubes. And what happened was, unfortunately, because of the wiring of that birth control implant, it literally made you infertile because it scarred over into your fallopian tubes, right? So imagine if you didn't know the implications of that and you have that, and that caused infertility. So sometimes lifestyle decisions cause infertility over time.
Mhm.
Then there's this category that I absolutely dislike, but it's a real one. It's called unexplained infertility, where you're having a period every month. Now you don't have PCOS, you don't have endometriosis. It's just unexplained infertility. For some reason, the sperm and your eggs are not talking right, and that is probably the hardest population to work with,
Mhm.
because oftentimes they are the ones that probably spend a lot of time with the IVF cycles, right? They are the ones that run through several options until they just spontaneously, hopefully find something that worked for them. But then there's this category, and I'm not talking about the full exhaustive list, but there's this category where I find myself working in the most as mechanical infertility. And a lot of the conditions that I just discussed can fall into mechanical infertility, but mechanical infertility in a more basic sense literally means that anatomically something has happened to either reduce the blood supply or scar down and render the gynoviscera, so that's your gynecological viscera, your organs, has rendered them immobile, right? So that can happen if you've had multiple surgeries, multiple gynecological service surgeries, multiple abdominal surgeries, where scar tissue has formed and literally affected the mobility of your uterus, your ovaries, and even your fallopian tubes, right? If you've had any conditions, if you've had any inflammatory conditions, maybe you've had, you have Crohn's disease, or you have bowel issues that have caused reoccurring inflammation to happen, even PCOSers, or a Hashimoto's, if you've had thyroid problems for years, right? Graves' disease. And that has reduced the blood flow into the areas, right? Maybe you have poor uptake in your lymphatic system. And so you've got pelvic congestion syndrome. And so so literally mechanical infertility is where something, and more commonly I see people that have even had their appendix removed, right? And the scar did not heal well. And so it affected the fascia in their pelvic area. And now we're not having healthy blood flow and healthy movement in their pelvic organs. And so that's, in the most simplest terms, the way to explain mechanical infertility.
Well, that makes sense. And I know for any PTs who are listening, that makes total sense because
Yeah.
we think about any other scar from any surgery, whether it's your knee, back, whatever. When a scar heals, even though it looks smooth on the outside, underneath are many, many, many layers of
Yeah.
fascia, of tissue that can get bogged down and decrease the mobility around the area, and it can cause other problems. So why would it be any different in your abdomen, in your pelvic region?
Absolutely. You got it.
So, and we know as PTs that different like soft tissue mobilization and scar mobilization and things like that can break up those adhesions and help restore the mobility. So, as a physical therapist and as a PT who treats mechanical infertility, is that similar?
Absolutely. It's essentially the same science, right? And I'll be remiss if I didn't speak to the fact that, let me tell you, your average physical therapists were not trained in how the viscera, right? How organs function and how they move, right? We are typically, what is like the four major systems in the body: musculoskeletal, neuromuscular, cardiovascular, and integumentary, right? That's where we spend a lot of our time. We don't spend a lot of time in the GI tract, right? We don't spend a lot of time talking about the reproductive organs, and we don't necessarily know how to move them very well. And so, but if you apply the same science we understand about scars, about post-op scars, we can essentially make some of the same differences in these areas, as long as we know what the viscera are supposed to do, how they're supposed to move, how they're supposed to behave.
Mm-hmm. That's
Yeah.
awesome. Would you say that in your practice that this is a common population that you treat?
Fortunately and unfortunately, yes. Yes, it is quite common. So I'll say that a lot of times, it's kind of interesting. A lot of times women who come to the practice may have come because they're having pain with intercourse, right? This is a common theme, right, in pelvic PT. But as we begin to work, they kind of mention, yeah, my cycles are kind of messed up too, or I've always had really bad cramps growing up, or yeah, we've been trying to conceive for a while. And so sometimes reproductive things do come up because they're coming to see a PT. They're not thinking that a PT can influence their reproductive health, right?
Mhm.
But we're in that area. And we have the ability to impact and make certain changes because we're already there. We're in the geography, right? So I think I like to always say that that's kind of where I piqued my interest, is because I was seeing women who are having issues with incontinence, bowel and bladder problems. And I'm seeing that as I'm working with them, I'm also influencing and impacting the way that their periods are.
Mhm.
Their cycles are becoming more regular. They're having less heaviness, or their flow is not as heavy. And so I was starting to see that because we are spending so much time in this geography, we're able to make more physiological changes.
That's great. And that makes me think about how important it is with seeing pelvic floor patients to like take a good subjective history.
Oh
And a
yeah,
lot of the times when people come in for one thing, so many other things come up. And you can
yeah.
find a different cause than what their referring diagnosis is.
Absolutely. So, like, let me give you a good example, Jessica. So, thinking about patients that may come and see me, let's say I think of a good person that maybe they have IBS, right? They have irritable bowel syndrome and they're having a really, it's like constipation one day, diarrhea the next, right? So, it's waxing and waning. And so, maybe your gynecologist had referred them to come see me for pelvic PT. As we begin to work, and we kind of talk about your periods because the subjective portion is by far one of the most useful parts of discussion when we're working in this population, right? And so they start to tell me about their periods and how, oh yeah, I don't my cycle, I don't go to work. Sometimes I have to call off of work. It's debilitating. I'm sleeping with a heat pad every night. I definitely live off of Tylenol. And it's just become this commonplace thing. And it's like, well, this is sounding a little like endometriosis, right? Because we know that interstitial cystitis and endometriosis can come together, and sometimes we can see some of that even with IBS. And so automatically we're not only able to influence their symptoms, but now we're also able to say, hey, why don't you go to your gynecologist and let's get that checked out, and let's make sure that this is not something that's going to affect, because even a stage 1 endometriosis is enough endo to make a woman struggle with infertility. And so if I'm having a 22-year-old girl who may not even be thinking about having babies right now, right? And who just wants to stop dealing with her gut health or having her gut fail her so often, I think it's great to just be able to get that collaborative care. Absolutely, right off the bat.
That's great. Would you
Yeah.
say that infertility is a symptom or a diagnosis?
Oh, that's a good question. I think it could be both. I think it can be both. I think that it's more symptomatic than really a diagnosis, but because of the way that we can help people in medicine, we treat it more diagnostically.
Mhm.
Because obviously, that unfortunately, like if you've been going through cancer treatments and chemotherapy, you can become infertile. That's a symptom that comes out of it, right?
Mhm.
Because I don't ever, and unless we're talking about someone who is struggling with, unexplained infertility, we typically see something else associated with their infertility. Like I've talked about, PCOS is a common one, right? Typically, once you get a PCOS diagnosis, then we know that we're struggling with some type of reproductive issue as well. But that's a good question. I love that one.
And literally, I'm asking that for myself because I didn't want to miss say anything. So
Yeah, I'm learning as much as you are, Jessica, and because you had me stumped there, I'm definitely going to go back and do some more research. But that was my honest opinion, is that I think it can be very much both. Mhm.
yeah, and that makes total sense to me too. So
Yeah,
that's what we're going with.
we're going to go with that. It makes sense to the both of us.
Yes, 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 yes. Okay, can you tell me about, is there like a specific protocol that you use in your practice when treating infertile women or women with infertility?
Sure, yeah. And I do prefer to say women who struggle with infertility because, of course, I don't like to label any, temporary condition to someone's life, right? So
Definitely.
I'll say that I picked up this Mercier technique, which is a protocol that I use to treat infertility. It's not to say that we have not, as physical therapists, been treating infertility with manual manipulative techniques for years. We definitely have been doing it. We've been researching it. I just sometimes like protocols. Protocols are helpful. They give us a little structure sometimes. And there is a great manual therapist, or I should call her, rather, she's a massage therapist, but she's a naturopathic doctor who came up with this technique called the Mercier Protocol. And so oftentimes if I know that if I'm treating someone with a true mechanical infertility issue, then what I do is I do a 6 treatment sessions, an hour each, and we're literally doing deep, visceral, manual manipulative techniques to be able to help their infertility. And so that's like, if we're talking protocol, right? That's a really good protocol that I refer to often if we're going to treat like a specific infertility problem.
So 6 for an hour. Is that
Yes.
exhausting for you?
You get used to it, you know. You build your stamina for sure. I think that you know, the work is rewarding. The work is you got to be called to it. It's not for the faint of heart, not just on a physical level, but on an emotional level too, right? So I think that I just build my stamina and I work out and make sure that I can keep up with it, because we are working deep. We're not massaging you. This is not a feel good kind of like spa therapy, but it's therapeutic, right? Mm-hmm. We're making physical changes. We're talking about undoing a physical and mechanical issue. So without a doubt, it is work, but it is very rewarding work that has great outcomes for sure.
Do you have any success stories that you would share with us?
Sure. So I will not share like specific stories just for patient confidentiality, but I'll say that in general, in some of the studies that we've already seen, we have seen that, especially if I can just talk about the Mercier Protocol, we see that women who are treated with the Mercier Protocol have an 83% success rate after getting treated. And within 1 year of getting treated, they are able to conceive. And so I'll share a story briefly. I think I have permission to share this one. Mm-hmm. So this particular individual had come and had a couple failed IUIs, failed IVF cycle as well, and was coming to see us. And this person was in her early 30s and was coming to see us after, I think this particular time she had did a failed IVF session, had done another IUI, and I think at this point she'd taken 6 months off. So she was tired, exhausted, just burned out. And at this point, she's got one blocked fallopian tube and the other one at hydrosalpinx. So hydrosalpinx is like a blocked fallopian tube on steroids. Let's just put it that way. It's an inflammatory process that happens when a fluid, it could be water, any type of fluid in the area is stuck in the fallopian tube and it essentially inflames. Mm-hmm. And so it's very painful and unfortunately renders the fallopian tube non-communicating. And so by the time she's coming to see us, she's at her wit's end and she's like, would I want to do IVF next? I don't know. We'll see, but I'm willing to try. So I go ahead and I treat her just using traditional mechanical traditional manipulative techniques that I've used, so not necessarily the Mercier Protocol. And we treat her. I think I saw her for 8 sessions. In particular, just like I said, her having this inflammatory process. She had some scar tissue buildup, and she also had a lot of hypersensitivity. So having to ease into the sessions was a big thing. We were not able to work as deep as soon. So we went ahead, and after we treated her, I actually referred her to a reproductive endocrinologist in the area that I trust, just because the hydrosalpinx is dangerous and can even cause miscarriages. And so it was very important to me that she doesn't just get pregnant, but she stays pregnant. Mm-hmm. And so I went ahead and referred her over to a reproductive endocrinologist in the area. And so she did conceive in 3 months. And within 3 months, just tracking her cycle, and we were able to safely monitor her pregnancy within the first trimester to avoid first trimester loss. And she worked well with the reproductive endocrinologist and has continued to progress in her pregnancy and is due, I think, in about 2 weeks or so. And so, which is amazing. Yeah. And so sometimes cases are that complex, right? Mm-hmm. And then there are other cases that are kind of like, hey, I don't want to do anything with IVF. I don't want to do anything with reproductive medicine, but my periods are irregular. I've got PCOS. Can you help me? And so in this particular person, another one, I think in her 30s, she came to me PCOS or irregular cycles her whole life and just never knew when she ovulated. And so I treated her for the 6 sessions. We did the Mercier Protocol for her and was able to conceive after a month because her period got regular, right when we were treating her. And she was able to conceive just because she knew when she ovulated, okay, which is a key thing.
Absolutely.
So sometimes things work just like that. And And sometimes they take a little bit longer, but that's why I really like to say that this is a fertility optimization support. We are able to optimize your fertility in general. So yeah, those are the two stories I think that come to mind that I feel comfortable sharing.
Yay, those are amazing. And it just shows how your skill in combination with education, educating your clients, as well as having a good referral source to give them
Yeah.
resources for, like in combination, all of those things, how successful like your patients can be. That's awesome.
Yeah. Oh, I did remember one story. They're coming to me now. I know because I do get permission from them to
Yeah.
share their stories, but there is one remarkable story, had been trying for 8 years, was never able to conceive at all, no history of miscarriages. Saw her one time, one time, and she was able to get pregnant. And she had a true mechanical issue that just had never been addressed. Right now, I'm not saying I'm some miracle worker. I'm not Harry Potter. Okay. I am literally out here, just honored to do this work, but it's just remarkable when we are able to honor women's bodies with the right skills. And I mean, till date, that's still one of the biggest, surprises to me. And I remember, I will never forget, she sent us a message and she was like, yeah, so I'm pregnant. And I go, how? See you once.
Oh,
You were in my office 2 weeks ago weeping. We were crying it out because you have not been able to conceive in 8 years. And I saw you one time and it just so happened to sync. And, she just so happened to, because we were going to do just a traditional physical therapy manipulative technique. So I wasn't seeing her back to back for 6 weeks. We were going to space them out, and homegirl was pregnant. And I tell you, this work is just, it blows me off my socks when I see it. And, there's some women that that have not have just not been able to see that they could accomplish this, right? Have always saw infertility as this big mountain that they were always going to have to keep climbing, right? So for some women, their story is going to be like Everest, right? You're going to struggle. Then there's other women that it's going to be more of like hills, that you're not going to see the same level, but given the right chance and the right support, our bodies can achieve so much, So I think it's crazy, Jessica, the kind of things I see. It really is.
I'm like emotional listening to you talk. Seriously, this is amazing. And I can just think about how many women, can be impacted by it, and how many women who, may have the diagnosis or the symptom of infertility
Yeah.
and know that there's mechanical reasons to it, and probably have no idea that physical therapy and manual therapy techniques can help. But I'm hoping that this podcast will get out there and help
Yes,
someone.
absolutely. Absolutely.
Yeah. So how can women like seek treatment from you specifically?
Okay. So I'm in the Dallas-Fort Worth area, and I do get emails and we get calls from time to time for women who don't live in the Dallas-Fort Worth area who just are curious. Can you treat me? Can I see you? And thankfully, and this is part of the reasons why I picked up the Mercier Protocol, is because she's got a good way of we can fit everything in 4 days. And so we can do the same procedure or the same protocol in a 4-day span, and we'll treat you over the course of 4 days. And so I do offer an out of town program. If you are looking to support your IVF cycle, support your reproductive health, right? Even if you're not actively trying, but you've got some issues that you need to overcome now, I love offering this out of town opportunity to women to come on in and let's get you treated. And then you can follow up with a reproductive provider in your area. But if you're in Texas, honey, if you're in Oklahoma, I could see you, we could treat you, we can make this work. And as like I say, I have a very personal story with infertility. And so I definitely know that it's not just about getting help, but it's getting the right help and getting trusted help, right? And knowing your body enough to know what it needs. And for some women, one cycle of IVF, they're pregnant. But for others, hormonally, they just don't respond in the same way and need more of a holistic yet scientific approach. Absolutely. So you can contact me via email. I've got a great office. We've got great providers. And you can contact us and just find out Even, and I get questions all the time. Hey, I'm going to get an IVF cycle in 2 months, and we're definitely going to do IVF because I'm this age. I don't want to talk. I just want to know if I can see you a few times before I get IVF. Absolutely. Why not? Let's make this a successful cycle for you, because we know that whatever you need to do scientifically and that's going to work for your body, let's optimize that. So absolutely. Because I know that question's going to come up if people are going to ask.
That's awesome. And I'm so glad that you have a local program and an out of town program
Yeah.
too, because we might have listeners that are not in Texas. So that is great. And what I can do is I can just put like your email and all of your contact information in our like show notes for the episode, so people can like go straight to you if they want to seek help from you.
Absolutely. And you can always just email us at the info@triggeredpt.com and just always put the subject line, hey, fertility. And, we're really good about getting back to you within 24 hours. My assistant's pretty amazing about that. And so we'll get you seen, because I do want to say, Jessica, that at this point in my life, I feel called to this work. And, I just feel that there are a lot of great reproductive providers in this world. But if our paths happen to cross and I get the honor to work with you, I don't take it lightly, and I see that, it's always funny because, when you go to PT school, you think you just go work with a bunch of athletes, and then you mess around and get called to something deeper.
That is my story. How did you know?
Okay, so you can relate, Jessica.
Yeah.
I was like, oh, maybe I'll just come back, work for, a basketball team or be an athletic trainer. And then you mess around and get called to something deeper, because our life is all about purpose, and we professionally get these opportunities and these skills, and then we